Today's nurses can do many things. They can work in administration, they can work in management, they can work in community or in public health roles, they can work in primary care with general practices, and they can also work, of course, in the acute sector in hospitals.
Primary care is a huge part of the Australian healthcare system, and primary healthcare nurses play an integral part in the success of this. Their ongoing chronic care management, their health education, their screening of cancers, etc., all aimed at keeping people well and out of the hospital system.
A day in the life of a practice nurse, no day is ever the same. You've always got something different, so it can range from health assessments, GP management plans, IV infusions, ear syringing, ECGs, and you see a whole range of age groups. So you see babies to adults, you're doing lots of vaccinations. It's interesting and exciting every day.
So primary health nursing is very comprehensive, and you get to know the patient and their family and their situation, which you may not always have in acute care nursing.
I think there's a very common misconception amongst clinicians that you get a better training or you see more things in hospitals, especially big city hospitals. My experience has been the complete opposite of this.
I feel truly grateful that I work and nurse in rural Australia. I love the freedom, so I think as a nurse as well, you become quite specialised in an area if you're working in a city. Whereas working in a rural area, you get to experience so many more opportunities. You get to step up to different roles.
Being a practice nurse is really rewarding because you do get that work-life balance, so you can spend time with your family of an evening and on weekends. But then, you can specialise in something that you really want to. You don't get stuck in a rut.
You work with diverse groups of people with diverse clinical needs. But I think one of the biggest things with primary health is the opportunities you have to work in such different environments.
We've always been an advocate for the patients, but I think we have maybe a stronger voice now working with the patients. We're more involved in the collaboration, we're more involved in the discussion about the healthcare and the healthcare of our patients or clients.
My feeling is that the time has come for nurses to take a much greater leadership role in healthcare. Nurses should be full partners and have a seat at the table, along with physicians and other healthcare professionals when it comes to quality improvement and the redesign of healthcare. Because I think nurses bring a really unique patient-centric point of view.
Here at the PHN, we employ quite a number of nurses in non-clinical positions, and the interesting thing is that every day they would use their nursing skills and experience in the work that they do. When I was a student nurse a really long time ago, we were trained in a framework known as the nursing process. Because nurses are trained in assessment and observation and communication, they're really well placed to design and implement creative solutions to really complex problems. And we see that here every day at the PHN.
You can't do nursing without being a leader and a team player. So that's how I think my career has helped me. I'm absolutely a team player, and most nurses are.
Bringing all of those skills together has really allowed me to capitalise on my experience and use my clinical background day to day to not only have a little bit of credibility when I'm talking about programs and services that the PHN commission with our providers, but also when we're looking at designing new services, I can then apply my clinical experience.
In terms of opportunities for nurses, I just think the world is your oyster. In terms of travel, you'll always have a job. You can travel Australia, you can travel the world. But I think also to think creatively around primary healthcare, especially looking at what are issues that you're passionate about, and Birthbeat is a great example, the business that I founded, because I'm so passionate about women having access to childbirth education that I essentially created a business around it. But I've got friends who are now specialising in diabetes education, becoming nurse practitioners, and forming their own private businesses around that because they're just so passionate about helping people in the community.
I am a very proud nurse. It's an absolutely wonderful way to spend your life's work. And I have so much respect and can only encourage nurses out there to do their best and be their best.
A big shout out to all of the nurses out there on International Nurses Day. You know, there's a lot of you out there working in a huge variety of different areas, and yeah, everyone is important and should celebrate International Nurses Day.
Happy International Nurses Day to all the nurses out there.
Just enjoy all of those wonderful things that you get to do as a nurse. As nurses, we laugh together, we cry together, and we should celebrate how great we are and the difference we make for communities and for people.
Happy International Nurses Day. It's so great to be able to celebrate with all the nurses, past, present and future. And if you're interested in really diverse nursing careers, make sure you hit us up here at the Primary Health Network.